Without wasting time, we'll go to our next speaker, who is Dr. Temilade Adegbite. She'll be taking us through depression and anxiety. Just permit me to go through her profile. Dr. Temilade Adegbite, a consultant psychiatrist with the Lagos University Teaching Hospital Idiaraba, Lagos, hails from Ejibo in Osun State. She is a product of the Laduke Akintola University of Technology, Ogbomoso, where she studied medicine and surgery. She is also a fellow of the National Postgraduate Medical College of Nigeria. Dr. Adegbite is passionate about children and adolescents and is currently running a post-fellowship training in child and adolescent psychiatry. She is vast in clinical research and healthcare management as a result of several years of experience in the hospital and healthcare industry. She's married and blessed with beautiful children. People of God, please let's make welcome Dr. Temilade Adegbite. Please keep clapping until she gets here. Thank you.
Thank you, everyone. Yes, once again, I'm Temilade Adegbite. So I want to say thank you to the organizers of the program. Yes. Sometimes you're like, okay, we're not doing enough, especially with issues that has to do with mental health. So this is a good one. Thank you. I welcome all the participants, our online participants as well, the chief host, our keynote speakers, my Oga, Dr. Adebayo. That was adequate and apt. Thank you for that presentation, sir. So I'm talking to us on depression and anxiety disorders. And why depression and anxiety disorders? Because they're about the commonest mental health conditions. So the next few minutes, I'll be talking about both. And I'm promising you I'm not going to take your time. Because I have about 20 minutes. And if I want to talk about anxiety disorders alone, that might take us another 1 to 2 hours. But as much as possible, I want to deliver what you need in terms of what are the common signs and symptoms of this mental health condition. Just last week, I had a client in front of me that came with his sister, and someone had actually referred them to the clinic. And the question was, okay, so why are you here? And the sister said, they just came because somebody told them to come. So what was the complaint? They said they had no complaint, and you could see all the signs and symptoms of mental health condition in the sister. One of it, permit me to say that, was the sister was speaking intonation, you understand, one accent like that. There wasn't part of her before that time. And the other sister believed that it was the Holy Spirit that blessed her sister with that accent. And she has been speaking the accent in the last 8 months, how the Holy Spirit told them to leave where they were living to another place, no shelter, and they've been moving around like that. And even up till last week, the sister could not recognize that the other one was sick. So depressive disorders, by way of introduction, everyone occasionally feels sad, but these feelings are usually short-lived and pass within a couple of days. Depression interferes with daily life, and depressive disorder is a common and serious mental health condition. So what are we saying? Sometimes we all feel sad, and that is not significant enough to say that somebody is depressed. By the time an individual is having persistent low mood, remember I mentioned it has to be persistent, occurring most times of the day, most days of the week, and then it must be present for at least a period of 2 weeks. Of course, not just persistent low mood, loss of interest in usually pleasurable activities, reduced energy, feelings of guilt, and so on. So by the time we have this symptom complex together in an individual, and then they are present for a period of 2 weeks, by that time we can say that, okay, maybe this individual is actually depressed. And that is different from normal, once in a while we feel sad, yes, we're not interested in anything. After a while, 1 or 2 days, you get out of that, and then you can move on with whatever you have with you. Depression is a mental disorder that is characterized by persistent low mood, loss of interest in pleasurable activities, reduced energy, feelings of guilt, low self-worth, poor concentration, poor appetite, weight loss, suicidal thoughts, poor concentration. I mentioned that, poor sleep, and then sometimes thoughts of ending their own life. In terms of how common are these disorders, when I started, I mentioned that it's about the commonest mental health disorder worldwide. Depression occurs across all ages: children, younger adults, youth, adults, elderly. Nobody is exempted from having depression, although the symptom complex may be slightly different in children, in adults, and then in the elderly. But of course, anybody can have depressive disorder. It cuts across all gender. It occurs both in male and females, across all socio-cultural groups. The Hausas are not exempted, the Christians are not, you understand, across all culture. And it is said to affect about 280 million people worldwide. And it is also one of the leading causes of disability worldwide. So we're trying to see the burden of this illness. It's everywhere. It's only in Nigeria. So it is estimated that 3.8% of the population is affected globally, and the prevalence in Nigeria is about 3.1. So that might sound just 3.1, but by the time you calculate 3.1 of the population of Nigerians, we'll see that the burden of this illness is actually huge, and it's important we get to know about it. What are the causes of depression? When Dr. Adegbite was talking the other time, he had mentioned some genetic predisposition. That is, it runs in some family. Environmental factors, which might be positive life events. It can be negative life events. Some of the times we think about, loss of loved ones, loss of properties, huge sum of money. It's also important that we know that it can be either way. So it can also be positive life events, such as the birth of a new child, promotion in the office, changing a status. Yes, they also have their pros and their cons as well. Biological, biomedical, we talk about medication. Some antihypertensives have predisposed some people to developing depression. Environmental factors, traumatic experiences, accidents, and so on. Personality of an individual, like we talk about people who have borderline personality disorder, they are prone to having depression and to having suicidal thoughts and suicidal attempts. What are the different types of depressive disorders? We talk about major depressive disorders, and the severity can be mild, moderate, or severe. Apart from that, we also have dysthymia in such a way that the individual has persistent low mood, but they're just low for a longer period of time. The other symptoms of depression are actually not there, and this can last as long as 9 months and even more. They're just a little bit below their normal mood, and that can be ongoing for a long time. Seasonal affective disorder, postpartum depression in those who have just given birth, and then atypical depression, and we can have it at a pole of bipolar affective disorder in such a way that we talk about two poles. We're saying bipolar, one pole is on the high side, the other pole is on the low side, and then at an episode they have the low, at another episode they can be high, and then it goes on and on like that. What are the common signs? Like I've mentioned, persistent low mood or empty feeling. But some of the times, don't forget that I mentioned that the symptoms might be slightly different in children, the adults, and the elderly. So for children, we might not have straightforward signs and symptoms of depression. Like I'm going to talk about loss of interest, low mood. For them, it might just be undue irritability. For more younger ones, it might just be non-specific symptoms such as abdominal pain, that you can't find a cause to what is causing the abdominal pain. It might just be refusal to go to school or refusal to do a particular thing, headache, that you can't find the cause, undue irritability. For them, they might be sleeping more excessively. For commonly in depression, they have problem with sleep, problem initiating sleep, problem maintaining sleep, and then they have early awakening. But in children and adolescents, for them, they might sleep more, they might eat more, they might crave for, chocolates and sugary things more when they have depression. And in the elderly, for them, they might not want to confess to you that they are feeling sad. It might just be some pepperish sensation, something moving all over their body and all that. Until you inquire into the other symptoms of depression, they might actually not come up with common symptoms of depressive disorder. So low energy, loss of interest in pleasurable activities. You have a child or somebody that is, jovial almost everywhere, likes to watch TV, likes to talk to people, happening type. You understand? And all of a sudden, the individual is just withdrawn to self. Those are common signs and symptoms. Poor concentration, guilt feelings like, yes, I'm responsible for some of the things that are happening to me now. Yes, it's even good. It's better for me like that. And so on. Poor sleep, suicidal thoughts. Sometimes we have depressive disorder existing with another condition. We call them comorbidity. And in a number of times, we have depressive disorder coexisting with things like stroke, hypertension, diabetes, like when Dr. Adegbite was talking the other time, poorly controlled, blood sugar, poorly controlled hypertension, cancer, chronic illnesses, end organ failure, chronic kidney disease, cancer, is enough for somebody to feel that, does it worth living when they have told, not you, the individual, that you have less than, how many months to live? That can actually be devastating. HIV, cancer, it can also coexist with other major psychological conditions such as schizophrenia. In terms of management, we take care of some of these conditions with it might just be talk therapy, which we call psychotherapy. Sometimes we use medication, which we call pharmacotherapy. And sometimes it might just be use of some other physical treatment, especially when they are not responding to psychotherapy, they're not responding well to pharmacotherapy, we might have to use some other measures, physical treatments such as ECT. And when we're talking about psychotherapy, we talk about cognitive behavioral therapy, in which we're trying to restructure the thinking of an individual. For example, I'm not good enough. It's a kind of cognitive defect. And then what do? They try to help the individual to restructure that, and then you can come to realize that I'm actually good enough. Something like that. We also talk about interpersonal psychotherapy. We talk about supportive psychotherapy, as the case may be, and use of medication. We have different types of medication. Not all of them are available in our environment, but generally around here, we make use of what we call serotonin, selective serotonin uptake inhibitors, and the use of TCAs, tricyclic antidepressant. Then, apart from that, like I mentioned, I said electroconvulsive therapy and the other ones for refractory, the ones that are not responding well to all the measures that I've mentioned. We have other things that we do as well. Without taking our time, I'll move quickly to anxiety disorders. So by way of introduction, anxiety disorders are abnormal states in which the most striking features are mental and physical symptoms, psychological symptoms, and physical symptoms are present most times in people who have anxiety disorder. In the absence of organic brain disease, we're saying that it has no underlying organic cause, and then there is no other, in the absence of another psychiatric disorder. We have all experienced anxiety symptoms. Like I said the other time, sometimes we feel sad, we feel low in our spirit, but that does not mean that we are depressed. So the same way in anxiety disorder, sometimes we have some of these symptoms. We are apprehensive, we are, restless, we are agitated, but that still does not mean that we have anxiety disorder. Yes. They are among the most prevalent mental disorders in the general population, and 1 in 4 persons met criteria for at least one anxiety disorder or the other. In fact, when we compare major depressive disorder and anxiety disorder is more commoner than depressive disorder, but many of the times people don't tend to present in the hospital. And many of the data that we have, many of them are hospital-based, is those that present in the hospital that we can say, okay, 1, 2, 3, 4 have a diagnosis of depressive disorder rather than the ones that are not presenting. 12-month prevalence is about 17.7%, lifetime prevalence about 30.5%. It is commoner in females than males, but other school of thought feels that is it because many of the times men don't present, or is it because they try to medicate themselves with substance, like Oga was talking the other time, that a lot of people cope in a way that is not ideal, that is not okay. They begin to use substance, smoke, all sorts of things, cigarettes, alcohol, whatever is available just to make them feel better because they have those symptoms. Prevalence decreases with higher socioeconomic status. In terms of etiology, like we have in depressive disorders, some are genetic. They tend to run in some families. Biological factors, they have mentioned some certain chemicals in the brain. And then we're saying that there's an imbalance in those chemicals. And when we're talking about chemicals, we're talking about things like serotonin, noradrenaline, and GABA. Environmental factors, such as humiliation, parental loss, even fights, parental fights, separation from parents, all of these things have been, implicated in the etiology of anxiety disorder. Looking at stress versus anxiety disorder so that we do not misdiagnose normal stress as anxiety. I have a picture there that is trying to separate the symptoms of stress from the symptoms of anxiety. And it's saying that stress is a physical or mental tension in response to a trigger. And some of the times for generalized or for anxiety disorder, we may not be able to put our hand or lay our hand on what is the direct cause of that illness. Then triggers can be something external, like an event that happens to you, or from something internal, like your own thoughts for normal stress. But in anxiety takes a trigger and turns it into bigger worries. So what are the symptoms of anxiety disorder? Many of the times, like I was talking the other time, I had mentioned the physical symptoms and then the psychological symptoms. So we talk about things like autonomic arousal, such that looking at the gastrointestinal system, we can have things like dry mouth, difficulty with swallowing, epigastric discomfort, excessive wind, frequent or loose motion. Let's take, for example, I'm here and I'm talking about anxiety disorder. I'm talking to a congregation of people. There are people who ordinarily cannot do that. And I'll say that even as I'm talking now, there's a bit of tension in me, and in a way, when you're talking to people, some people that have put some water, there's no way you won't have some form of, my mouth is a bit dry, but when that goes beyond normal, then we can be thinking about some other, and then it is persistent for a longer period of time. Respiratory, there could be chest constriction, difficulty breathing, chest pain, chest tightness, chest missed beats, palpitations, feelings of heartbeat, menstrual discomfort. Some might have amenorrhea, their menses might not come, fearful anticipation. Some might be unduly irritable, oversensitivity to noise, worrying thoughts, problem with sleep, insomnia, night terror, tremor, headache, muscle aches, and then the list can go on like that. And for different types of anxiety disorder, some of them might just appear free-floating, and then they are continuous, like in the case of generalized anxiety disorder, different from a case of, let's say, panic disorder that is episodic, and then it occurs for a number of, time, and then it disappears until it comes again. And then in the case of maybe specific phobia, the anxiety symptoms occur in a particular situation. So, what are the types of anxiety disorder? We have the generalized anxiety disorder, the obsessive compulsive disorder, panic disorder, social anxiety, specific phobia, post-traumatic stress disorder, and so on. In terms of treatment can also be psychological. It can be through the use of medication, pharmacotherapy, and then we can also make use of some other physical treatments, like I mentioned in depressive disorder. Psychological, we talk about cognitive behavioral therapy, use of relaxation training, anxiety management, social skill training, graded exposure, flooding, and some other coping mechanisms that I know that Dr. Ajiro Tutu is coming to talk to us about them. Use of medication, we use selective serotonin reuptake inhibitors as well, and we call them anxiolytics. Use of benzodiazepine, depending on how severe the case is, and then we make use of some other physical treatments, especially when the illness or the symptoms are not responding normally to either medication or psychotherapy. But above all, I have here Matthew chapter 11, verse 28 to 30. It's a verse that I love so much in the Bible. And it says that, Christ was talking to us and he said, "Come unto me, all ye that are labor and are heavy laden, and I will give you rest. Take my yoke upon you and learn of me, for I am meek and lowly in heart, and ye shall find rest unto your souls. For my yoke is easy and my burden is light." But many of the times, we human beings, we like to carry our burdens on our own. We are holding on to what we cannot solve. We carry so many things in our heart. We carry so many things on our shoulder. But somebody is there, is telling you, put all your burden onto me. I'm here to make them light and take all the burden. If it is easy for us to just, put everything onto that person who is able to solve all the problem for us. I'm using this time to encourage us. Death of loved ones, debt, loss of job. Yes, before we get there, somebody already knows. Even before we were born, somebody understands some of the things that are going to happen to us. And he said, our ways, God's way is actually different from, but many of the times we want our way to be. May God help us all. Thank you.
Please put your hands together once more for Dr. Temilade Adegbite. Thank you very much. Good afternoon, everyone. I hope we're having a good time. The two addresses we've had have been very insightful. I just want to remind us that if you have questions, please note them, pen them down so that when we get to the Q&A session at the end, you can ask your questions. And for our participants joining online, feel free to drop your questions in the live chat and we'll address as many questions as possible.